Have you seen these marks before? Have they been abducted by aliens, or is this some sort of a fashion trend? Chances are they've had cupping therapy, but is this some sort of a gimmicky treatment, or does it legitimately have some benefits? Let's find out. Hi, this is Mike Wong, physiotherapist from EastWest Physiotherapy. In this video, I'll give you an overview of what cupping therapy is, how it is done, what to expect if you're receiving it, and look at some of the current research evidence behind this type of treatment. Cupping therapy has been used as traditional Chinese medicine to help treat a wide range of medical issues from autoimmune disorders, arthritis, to improving breathing from common colds and flus. It has been used for centuries and has a rich history in providing relief for musculoskeletal issues, perfect for what we try to achieve in our physiotherapy practice. The earliest documented use was from ancient Egypt. It's primarily used in Asia, Eastern Europe, and more recently, over the last few decades, into North America. Cups can be made from silicone, bamboo, plastic, and glass. The suction can be created by heating the air inside the cup with fire. As the air gets hotter, it expands. As it cools down, it contracts. This contraction of the air creates a negative pressure, creating the vacuum that lifts the soft tissues. Suction can also be created with a handheld pump or electric vacuum device. There are various techniques of cupping: dry, wet cupping, flash cupping, and cupping massage. Depending on your condition and tolerance, different techniques are used. Dry cupping is the application of the cups on the skin without drawing blood, whereas wet cupping involves making a cut to the skin using a sterile needle, then applying the cups on the wound, which will create a vacuum to draw the blood from the wounded area. Our review will focus on dry cupping for muscle and joint pain, as wet cupping is more invasive and not applicable in our physiotherapy practice. Placement of the cups are generally on specific acupuncture points and areas that have tension as indicated by your practitioner. When cupping is applied to the skin, it feels like there's a lift in your soft tissues, muscle, and fascia. And depending on the size of the cups and the intensity of the suction provided, there may be some initial tension and discomfort. This will gradually subside as the soft tissues around it relax. You can place the cups in specific locations on the body, or with some lotion and oil, you can perform a cupping massage, moving the cups back and forth over the body region being treated. This can be done along the acupuncture meridians, and a lot of people find this comfortable as it can help release myofascial tension and break adhesions. I often refer to this technique as reverse massage, where instead of pushing down, the cup pulls upwards on the skin and soft tissues. Cupping has been labeled sham placebo effect due to the difficulty in explaining the physiological processes involved in making it effective. The treatment ended up falling out of favor in Western medicine, not because it doesn't have any therapeutic benefits, but because of its inability to explain how it works. In the past, practitioners have described how it can suck out evil spirits that cause body aches and pain, not exactly an explanation to justify its use for Western medicine. But as a therapy used and passed down from over 3,000 years, with many who reported benefits from it, there is definitely some value to look into it. In our practice, our patients report they experience relief from muscle tension and pain, and it helps promote general relaxation and speeds up the recovery process from exercise. The best hypothesis so far to explain pain relief from cupping is the neuromechanism theory that is used for acupuncture. In traditional Chinese medicine, cupping therapy is often used on acupuncture and acupressure points, and by applying cupping on the acupuncture points on the body, nerve fibers are stimulated, which helps send impulses to the spinal cord and brain. Schultz in 1996 have demonstrated that these specific points can stimulate blood flow, lymphatic drainage, release endorphins, boost the immune system, and affect the central nervous system that interprets pain sensation. Wolf and Salter in 2000 suggested that cupping can also help manipulate the skin and inhibit the sensation of pain. The microtrauma to the soft tissues from cupping can also help to stimulate blood flow and the body's healing potential. A systematic review by Wood et al. In 2020 looked at 21 different studies using cupping as a treatment technique for various conditions like neck and back pain and knee osteoarthritis. The review found that based on the evidence, there are some encouraging findings that cupping can help decrease pain, improve function, and the quality of life in those particular conditions. So there is promising evidence that cupping, even as a single treatment modality, has some benefit to improving pain, relief, and function. So that is why we're starting to see a resurgence in cupping therapy for various muscle and joint pains, as well as a technique to help improve physical recovery. As with most studies, more research is needed with a larger group and a larger sample size. Cupping is a relatively safe modality to use when performed by a qualified practitioner. Common side effects are bruising and mild soreness in the area of treatment. Cupping therapy is a great way to help stimulate the body's healing potential and create relaxation in the body. When combined with healthy living habits like proper sleep, diet, exercise, and stress management, the results are even more significant. So I hope you have learned something about cupping therapy and be open-minded to give it a try. If you like this video, please hit the like button and subscribe to our channel. Thank you for watching. Bye for now.